Nursing care plan for chemotherapy, nursing assessment, medical and surgical history, previous surgeries, medical conditions, allergies, chemotherapy treatment plan. Understand the specific chemotherapy regimen the patient is receiving, type of chemotherapy drugs, dosage, frequency, and route of administration. Second one is vital signs. Monitor patient's vital signs, blood pressure, heart rate, respiratory rate, temperature. Assess for any abnormalities or deviations from the patient's baseline. Third one is physical assessment. Cardiovascular system. Assess blood pressure, heart rate, and rhythm. Auscultate heart sounds. Detect abnormalities, murmurs, or irregular beats. Assess peripheral pulses. Assess capillary refill time. Assess patient's skin color. Monitor the patient's oxygen saturation levels. Respiratory system. Observe respiratory rate, depth, and effort. Auscultate lung sounds. Detect abnormalities such as wheezing or crackles. Assess the patient's oxygen saturation levels. Monitor the patient's cough, sputum production, and any shortness of breath. Gastrointestinal system. Assess the patient's appetite, bowel movements, and changes in bowel habits. Observe for any abdominal distension, tenderness, or masses. Monitor the patient's oral intake and hydration status. Genitourinary system. Assess urinary output, urine color, consistency. Inquire about any changes in urinary frequency, urgency, or pain. Observe for any signs of urinary tract infection or kidney dysfunction. Musculoskeletal system. Assess the patient's mobility and gait. Observe for any deformities. Observe limitations in range of motion. Observe signs of muscle weakness. Assess any pain, tenderness, or swelling in the joints or muscles. Neurological system. Assess the patient's GCS level, eye response, motor response, verbal response. Integumentary system. Assess skin for color, temperature, moisture, and any lesions. Assess for any signs of skin breakdown, pressure ulcers, or wounds. Observe for any rashes, bruising, or jaundice. Document any changes in hair or nail condition. Next one is laboratory tests. Complete blood count, CBC, liver function tests, kidney function tests, and coagulation profile. Identify abnormalities that may impact the patient's chemotherapy treatment or increase the risk of complications. Next one is psychosocial assessment. Assess the patient's emotional well-being. Assess coping mechanisms and support system. Assess patient's anxiety, depression level. Provide appropriate support and resources as needed. Nursing diagnosis. 1. Imbalanced nutrition less than body equipment related to adverse effect of chemotherapy, loss of appetite, nausea, and vomiting. 2. Fear and anxiety related to disease condition. 3. Fatigue related to anemia. 4. Disturbed body image related to weight loss and alopecia. 5. Risk for infection related to neutropenia. 6. Risk for impaired skin integrity related to adverse effect of the chemotherapy. 7. Risk for injury related to bleeding from thrombocytopenia. 8. Risk for constipation related to adverse effect of chemotherapy, psychological factors. Nursing diagnosis. 1. Imbalanced nutrition less than body requirement related to adverse effect of chemotherapy, loss of appetite, nausea, and vomiting, anemia. Goals. To maintain normal nutritional status. Planning. Give oral care before eating. Administer medication as prescribed antiemetic before chemotherapy. Give warm meals. Encourage small, frequent meals. Check body weight daily. Administer iron and vitamin supplements as prescribed. Implementation. Give oral care before eating. Administered medication as prescribed antiemetic before chemotherapy. Gave warm meals. Encouraged small, frequent meals. Checked body weight daily. Evaluation. To be evaluated later. Body weight. Nursing diagnosis. 2. Fatigue related to anemia. Goals. To minimize fatigue. Planning. Monitor blood count, hemoglobin, hematocrit. Monitor vital signs. Administer blood products as prescribed. Observe patient's physical response to activity. Educate the patient and family members about disease condition. Implementation. Monitored blood count, hemoglobin, hematocrit. Monitored vital signs. Observed patient's physical response to activity. educated the patient and family members about disease condition. Evaluation: blood pressure, pulse rate, respiratory rate, temperature, hemoglobin level, hematocrit level. Nursing diagnosis: 3. Disturbed body image related to weight loss and alopecia. Goals: to strengthen coping for altered body image. Planning: reassure the patient, suggest wearing a wig, educate about disease condition and chemotherapy, provide real information, encourage patient to stay on therapeutic program. Implementation: reassured the patient, suggested wearing a wig, educated about disease condition and chemotherapy, provided real information, encouraged patient to stay on therapeutic program. Evaluation: to be evaluated later. Nursing diagnosis: 3. Disturbed body image related to weight loss and alopecia. Goals: to strengthen coping for altered body image. Planning: reassure the patient, suggest wearing a wig, educate about disease condition and chemotherapy, provide real information, encourage patient to stay on therapeutic program. Implementation: reassured the patient, suggested wearing a wig, educated about disease condition and chemotherapy, provided real information, encouraged patient to stay on therapeutic program. Evaluation: to be evaluated later. Nursing diagnosis: 4. Risk for infection related to neutropenia. Goals: to prevent infection. Planning: monitor vital signs, administer medication as prescribed, antibiotic, monitor WBC level, improve personal hygiene, monitor any signs and symptoms, maintain aseptic technique. Implementation: monitored vital signs, administered medication as prescribed, antibiotic, monitored WBC level, improved personal hygiene, monitored any signs and symptoms, maintained aseptic technique. Evaluation: blood pressure, pulse rate, respiratory rate, temperature, WBC level. Know any signs and symptoms, but patient has risk for infection. Nursing diagnosis: 5. Risk for constipation related to adverse effect of the chemotherapy and psychological factors. Goals: to prevent constipation. Planning: assess bowel sounds, administer lactulose as prescribed, encourage diet with adequate fibers, encourage patient to increase fluid intake. Implementation: assessed bowel sounds, administered lactulose as prescribed, encouraged diet with adequate fibers, encouraged patient to increase fluid intake. Evaluation: to be evaluated later.